This little beautiful item is a T-bar, and this T-bar will save you time, it will save you energy, and it will save your thumbs and hands. This has a specially designed tip with a very padded end so that it feels very comfortable to the patient. And you can put this almost anywhere, but I especially use this in most aspects of the thoracic and lumbar spine. And this is a very important item if you want to become very specific and dedicated to this work. So this T-bar you can also purchase on this website. Go to the products section. It's available, and you're going to see now how I use this wonderful little inexpensive tool. So when you're working on the ribs, and you'll be working on the ribs with the T-bar, it's important to realize that the ribs enter the transverse process and the body of the vertebra like this. And so where you'll want to put your T-bar is right on this intersection here, so you can mobilize both the point of contact of the rib and the vertebra. And this will be an extremely important and very valuable technique for working on rib problems. So in using the T-bar, which we talked about, you can do a general scan, and then when you find a tight area, you can look for the tight spot, and it'll feel like a little raised area. You can put your finger just below that. And then what you can do is you can put the T-bar on the spot just above your finger, and you ask the patient to sit up nice and tall and arch your back. And that will take care of extension, believe it or not. That's very effective at helping extension. If you want to go a little further, you can get more of what we call the closed pack position by saying arch your back, stick your belly out, and then lean to the right a little bit. And that will create a closed pack position, give you a tremendous release. And when the person leans to the right, you can tell that that has really loosened up. So by finding the tight area and then looking for the tight facet joint, locating that spot, and then putting the T-bar just above where your finger was, and say arch your back, stick your belly out, and then lean to the right, it'll stop. And then as the person leans gently and the bone releases, it will move, and you will have mobilized that area. So now we're going to work with the lumbar spine in the same way. So I will look for the tight area, and then look for the tight facet joint on either side, and then I'll mark it with my thumb or my finger, and then I'll put my T-bar just above it and say arch your back. Good, and then we'll lean just a little bit to the side. Perfect. And you can make this kind of rhythmic, where you go up and down and arch your back and then relax. And you're working on those very tight joints and arch your back. And this is very gentle. This T-bar really makes it so easy to loosen these areas up. So arch your back, and then you can lean to the same side. So when you're working on the low back, it's very important to treat L5-S1. And you'll see that if you go from the crest of the innominate bone or hip bone, that's about L4. If you drop down just about a ½ inch to an inch, depending on the size of the patient, that is L5-S1. So we're going to work on that spot. You'll find that if you go just below that, you'll be on the hard sacrum. So that's L5-S1. It's very important since that's the last vertebra of the spine. And what you're going to do is you're going to put your T-bar there and again have the patient arch their back and then lean, and that's a tight area. That's really stiff. See, that's not even yielding yet. So we're going to hold that until it releases, and it will allow, there you go, and now it's moving. And that's how we treat the very important area of L5, S1.